You know, it's not always an easy conversation to have, but it is important talking to your teen about sex and pregnancy. So we're going to learn some conversation starters this morning with an expert. In your Health Watch this morning, you know, images on television and movies may sometimes make it seem like teenagers are more promiscuous than ever, but it seems they are, in fact, making smarter choices in recent years. That's some good news. So what can we do to further that? Dr. Sharon Thompson is joining us to talk about the declining birth rate, some perspective to just set up our discussion. In 2014, about 250,000 babies were born to teenage girls. Compare that with 550,000 in 2011. So some messages are being heard, whether that means a decrease in sexual activity in general or an increased use in contraception.
And the data is showing that there's not a decrease in sexual activity as far as we can tell, but smarter choices, as you described. So more teens are using contraception and using longer acting methods that are very effective. So we are getting through there. And
what would you credit for that? I mean, is that conversations at home? Obviously, we want the information and the advice and the guidance to start at home, not friend to friend, not on your cell phone or on the internet.
I absolutely recommend that parents be the information choice for their children, because if they're not, someone else will be. And that someone else may not have as good information, as reliable as the parent can have. Also, parents are the first people to give kids values and attitudes and knowledge that they take out into the world. So don't skip those conversations, awkward as they are. Start it at home.
Incredibly awkward when you think about it. At what age do you begin, and what advice can you give us for starting those conversations?
Sure. There's no age. It's not 11 or 5, but you want to be open to your children at every age. You know, toddlers ask you the embarrassing questions at the wrong moment, but you want to be open. You want to answer those questions, even if it's awkward, so that your child gets the message that they can come to you with anything.
I imagine that a lot of teens would just kind of try to maybe shut down the conversation, like, oh, no, I'm not doing that, I'm not doing this. One of the conversation starters that's listed here is even discussing a television show or a movie. Oh, I see this happened here.
Absolutely.
Have you ever, or you or your friends encountering this?
Yes, those are great places to start. We know we live in a culture that inundates us with sexual imagery, and so use it. A scene comes on in a movie and you talk about, how do you feel about that? Have you and your friends talked about it? So you use those moments to bring up what could otherwise be awkward, and don't preach. Just bring up the conversation and listen to your teen. Again, stay open, don't preach, don't nag, but bring it up. Don't avoid it.
And that's got to be probably the hardest part, but you do want that conversation to continue. That's the only way you're going to really know what's going on, right?
Absolutely.
One of the things you recommend also is bringing a doctor into the conversation when possible. So maybe this is something that can be discussed in the presence of whether it's your pediatrician or if you're taking your teen already maybe to see a gynecologist.
Sure, because these conversations are awkward and they make us uncomfortable. So use your resources. You're going to the pediatrician's office. You can either start in the car. I recommend the car is a great place. Low pressure. It's going to end. It's going to be short. They can't get away. And so definitely use the car to start that conversation and say, hey, here's what we can expect at the doctor's office. They may want to talk to you about X. You may have some questions. So use that time to really get your teen to start thinking about someone they can ask these questions of in addition to you. Also, you can use a pediatrician as a foil and say, hey, the pediatrician told me blank. I want to ask you about X. So blame the doctor a little bit. It's okay.
You don't mind that at all,
We don't mind. We don't
Dr.
mind.
Thompson, great to see you. Thank you so much.
Thank you so much for having me.
Challenging conversation to have with your young person, but certainly beneficial. April?